Good afternoon, everyone, and welcome to today's webinar, sponsored by Workday, ranked best in class in ERP for 2 years running. I am Brian Zimmerman, Custom Content Editor for Becker's Hospital Review. I'm pleased to introduce today's webinar, The Fight to Stay Relevant, Taking the Bold Path to Become an Ambidextrous Company. We'll begin with introductions, followed by a presentation featuring speakers from Christiana and from Workday. Then we'll have time at the end for an audience question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is my pleasure to get us started by introducing Sarah Hickman-Auger, Senior Industry Product Marketing Manager for Healthcare at Workday. Sarah, the floor is yours.
Thanks, Brian, and thanks to everyone for joining us today. I am so pleased to be joined by two of our customers from Christiana, and today is really about their journey and how Christiana is embracing the changing world of healthcare. Before turning things over, I'd like to introduce our speakers and give you a little background on each of them and their organization. First, we'll hear from Kristen Raber. Kristen has been leading change in the healthcare technology field for the past 13 years. Currently, she serves as the Corporate Director of the Cloud Innovation Lab at Christiana. Her path to working in healthcare started on the sciences side and over time led her to information technology. She brings experience in financial services, science, and business, enabling her to provide great insight to the innovation endeavors at Christiana. Kristen has spoken at numerous healthcare industry conferences on subjects ranging from interactive patient care, medication management, machine learning, and quality and safety. And as a result of her role and success in numerous IT initiatives, she was personally selected by her health organization's leadership team to launch the Cloud Innovation Lab at Christiana. Here with Kristen is Dana Parker. Dana continuously pushes traditional boundaries to deliver outside-the-box solutions that change the status quo. Over 20 years' experience in human resources, technology, and service delivery have gained Dana a reputation for being innovative, resourceful, and forward-thinking. She really thrives in her ability to leverage current platforms in creative ways that improve experiences, both for the business and consumers. And by investing in a creative culture of exploration and purpose, Dana has successfully developed multiple teams focused on innovation. As the Corporate Director for Shared Services at Christiana, Dana leads over 30 team members spanning multiple disciplines, including shared services technology, operations, and the caregiver call center. I want to provide just a little perspective on Christiana as an organization. They are the largest healthcare provider in Delaware and a leading provider of healthcare in the Philadelphia region. Christiana serves the community and their neighbors in the surrounding areas of Maryland, New Jersey, and Pennsylvania, and they've been doing that for more than 100 years. They're also the largest private employer in the state of Delaware with more than 12,000 employees whom they call caregivers. Christiana is widely recognized for their excellence in healthcare, as you can see by the numerous awards here on the screen. Digging into just a few examples, they've been continually ranked a best hospital by U.S. News & World Report and were recently listed by Newsweek among the world's best hospitals. They also achieved the Healthgrade's America's 100 Best Hospitals Award for a third consecutive year. That places Christiana in the top 2% of more than 4,500 hospitals assessed nationwide. And they have also been designated the most wired for the third consecutive year by the College of Healthcare Information and Management Executives, or CHIME. Christiana has been a leader in the healthcare industry, focused on innovation not only with regard to the care that they provide their patients, but also in the way that they manage their workforce. So in addition to being a nationally distinguished provider organization, they're also a really important partner for Workday as we deliver on our commitment to the healthcare industry. We've been fortunate to have Christiana Care serve on Workday's Healthcare Advisory Board, and they contribute their perspective on where healthcare is going and the ways in which enterprise software solutions can continue to support the mission of care. Most recently, as a member of our design partner group for credentials, Christiana Care has shared their industry-specific use cases with regard to the credential management process. Credentialing is instrumental to their business, not just for their healthcare professionals, but also for their volunteer network. So with those use cases in mind, they've been highly engaged in the design partner discussions to ensure there's a proper level of understanding for how things work today and how we might streamline management and verification of credentials for the healthcare industry in the future. We really appreciate how Christiana Care has leaned into Workday, always looking at how they can leverage the product as they look for new opportunities to do things differently. And you'll hear from Kristen and Dana today about how they take that same innovative approach in everything they do. What we hear from our customers is that as healthcare organizations are looking at new delivery models, evolving your business models, and evaluating investment opportunities, it's so important to be able to connect with peers in your community to learn how different organizations are taking advantage of specific technology and partnerships, and to really share those best practices and lessons learned. We see a lot of that within our Workday Healthcare community, and we're really happy to be a part of sharing the Christiana Care story today. And with that, I'll turn things over to Kristen.
Hi, thanks, Sarah. So I'm excited today to talk about Christiana Care and how we are becoming an ambidextrous organization and why we are investing in exploration around new partnerships and around exploration of emerging technologies. And I'm going to start out with the quote, "Why is the rum gone?" Right? For those of you who probably know Pirates of the Caribbean, this is a great quote. This is when Captain Jack Sparrow has been abandoned with his companion, Elizabeth, on an island by other rogue pirates. And Captain Jack Sparrow is waiting for the rum runners to show up. He's found the rum. He's willing to just sit there, drink, and just wait for help to come. Right? But Elizabeth, his partner, has a different plan. She waits till he passes out. She takes all of that rum, basically lights up the entire island, all the palm trees, creates a huge smoke signal, and help comes immediately. Right? And I feel like that's where we are sort of today in our world. We have to not sit back and be complacent. We have to really, go after those big problems and not just wait around for other people to come by and solve them for us and actively engage in innovation. And so part of that is really thinking, what can we do to make the impossible, that's what seems impossible today, possible, right? Everything in this world at one point, I'm sure, seemed like it was impossible, right? And so how do we take those problems, use the emerging technologies to redefine that? Artificial intelligence, blockchain, 5G, augmented reality, all of these things have huge potential to be able to change how we run our business and how we deliver healthcare services today. Right? But to do it, partnerships are really key, right? So we're thinking outside of the box on our partnerships and how we form them, not only within our organization and not only within our industry, but looking at those unconventional partnerships as well and making sure that we're creating the right structure around it. Right? But you can only do that if you've created capacity. So Dana, my partner in crime here, is going to talk to us a little bit about how her team is creating capacity in the operational world to support innovation, not only in my area, but in her area as well. But really, to make it successful, it's about culture, right? It's about looking at things differently, removing the assumptions, and really creating innovation as a core competency within your organization itself. So this, what you're seeing now, innovate boldly with courage to solve real-world problems with deep impact. This is our mission statement for innovation here at Christiana Care, and I'm actually really excited about it because I think it very well sort of states what we're going for, right? I'm looking at real-world problems. I want to make sure that what we're going after is going to make big leaps forward for us, not only as an organization, right, but within our industry and our ability to take care of the people that trust us with their care. But that takes courage. And that takes being bold, because most often those things that we are doing are truly disruptive to the business. They are outside of what they normally do and how they think of how they deliver care. And so you need some really good support to do that.
Kristen, you know, courage, you nailed it. Courage is absolutely what we need to have in place in order to pursue innovation.
I'm going to take it back a minute and just talk about my own sort of personal journey. As Sarah mentioned, I've been in healthcare for 13 years and in technology for a little bit longer, and you know, it's been great, right? I've been able to implement some really big systems and make some big impacts across the way we do our operations today. But there's kind of a point where I reached a moment where I knew I wanted to do something else, and we sort of all have these moments within our lives, and within, I would say, even within healthcare especially, you run across stories that deeply impact you, certainly all the time, but every once in a while there's one that stands out. And I had just sort of finished implementing a really large project and kind of looking for the next thing to do. And I was driving to work, and I heard about this story about a scene that had occurred on a train station platform. And the reporter's quote from that scene, the actual tweet that she sent out, I'm gonna tell you right now. Awful scene on the Orange Line. A woman's leg got stuck in the gap between the train and the platform. It was twisted and bloody. Skin came off. She's in agony and weeping. Just as upsetting, she begged no one call an ambulance. It's $3,000, she wailed. I can't afford that. And so I think what really struck me there, for me, was sort of that there's something fundamentally wrong with this, right? It's the fact that I can't even call 911. You have a woman that is stuck between a train, and a platform. She is bleeding heavily. There are actually people surrounding her trying to push the train off of her. There is somebody that's trying to support her body weight, somebody else trying to stop the bleeding, and others trying to call 911 to get her help. And this woman is more concerned about just even having someone come get her to take her to the hospital, right? Just that call to 911, and she's in a life and death situation. And 911 is something that we learned to call as children. It's probably the first number that all of your kids learned, right, to dial on the phone, right? And so the fact that healthcare costs are considered that insane, right, that there is a single instance that really can drive people into financial ruin, even those that are relatively financially stable. There is, as far as the United States, we are one of the biggest spenders of healthcare in developed countries, and yet our outcomes don't reflect it, right? And so something truly has to give. It cannot continue like this. We have to be able to solve that problem and do it boldly. We have to look at big opportunities to drive down our costs and come up with more efficient ways to do our business and to take care of people. And so we started facing this problem, or really taking a deeper look at it, I should say, and committing to it at Christiana Care by looking at how do we create innovation within our organization. And so Dana and I got together and started talking about what a structure could look like for my Cloud Innovation Lab and how that would fit into what she does today to support our operational space. And we really looked at it from what are the tools of today, right? The tools that we use to expand and optimize today's business. And then how do we look at the tools of tomorrow, right? Those emerging technologies that really have the capability, that potential to drive the impacts of change. And where these tools of tomorrow sort of come into the tools of today is really where mainstream adoption comes. And so that seemed like a logical space for us to divide up. And so my space is really on what I call the edge, right? The edge piece of the Ambidextrous organization, the one that focuses on those tools of tomorrow. And Dana's space is on focusing and strengthening our organization by expanding and optimizing the core business with today's tools, and then using those tools in a new and unique ways into adjacent space as well. But tight partnership is extremely key for that to happen. Right? And tight partnership not only within your organization, but tight partnership with those outside of your organization that can help make it happen. So the Cloud Innovation Lab is all about creating those new partnerships. It is, like I said, it's only about a year old. So we've been working on our structure and setting up this year and really focusing on building out the structure with one core partner, right? And looking at that partner to really help us drive forward the innovation by bringing together the people, the technology, and the skills to solve the problems that we've identified, things that are holding us back from taking care of our population. How do we serve our mission better? How do we bring value to our patients, to our neighbors, and to our communities? Okay. So we look at our Cloud Innovation Lab really as three components to solve that. One is around partner strategy and acceleration. Okay. As I mentioned, we chose one partner. It's the first partner. We'll be looking to expand to a second partner this year. But we were very thoughtful in how we decided to choose that partner. Right? We wanted somebody that was going to be very innovative with us. And so at Workday was actually the partner that we chose. And since we've initiated with them, we've been involved in a number of explorations with them and design partner groups, especially with those focused on emerging technologies. So artificial intelligence, how do we look at our journal lines and be able to provide better analysis of them? How do we have better business insight to know how do we need to make our business better? Where do we need to focus? What really drives those outcomes to our population? Right? And how do we make sure that that insight gets into the hands of those that need it? Artificial intelligence is going to make a huge difference moving forward. We have tons and tons of data available. The fact that everyone's putting stuff out on those cloud platforms allows for this massive expansion of data. But we're data rich. We're very information poor. We don't have the tools that we need yet today to really drive those insights, right? And so that's one direction we're going with emerging technologies, one technology that we're using. Another one is around blockchain technology. I think Sarah sort of mentioned it in our introduction. We've been working with Workday on what I see as really the first truly viable use of blockchain technology in the healthcare space. And that's around credentials. How do we provide, or the ability to be able to provide information as verified information, give it to the individual to be able to carry within a digital wallet, right, and be able to share that information to others. And it's considered primary source verification. So there's across the industry, that's, you start thinking about how did I apply for a job, right? And the amount of work it takes to verify my employment, my salary, and other things, right? That alone can slow us down as a business. But within healthcare, we have use cases that are just, when I started digging into it, I have to say I was a bit aghast, right? Our physician credentialing, it's over 35 pieces of information that we need to verify for our physicians in order for them to get started. And that's 35 pieces of information that takes us 3 months, 90 days, for us to verify from different, schools, government entities, and so forth and so on to meet the requirements to hire them. And then even after that 90 days, it takes us another 90 days to be able to credential those physicians with all the different payers, right, so that we can get paid correctly for the work that we're doing. And so that's a huge inefficiency for us. It affects our ability to bring in the right care, to bring in the right people. It's a huge dissatisfier to keep these physicians waiting. And, on top of that, I can't scale up the way I need to scale up and handle the needs that I have, right? And so that's one example. where, through the use of emerging technologies, we're really going to redefine how we're doing business. Part of that partner strategy and acceleration, too, is not just that design group part of it, right, to be involved in providing sort of the use cases and helping for a better product, but a lot of it, too, is in strategy, right? So we're building tighter relationships with our vendors. How do we truly get to the beginning of their product strategy map? How do we help inform them? Let them understand, get great insight, dedicated insight, right, strategic insight on what our problems are, right? Ones that we face as an organization, ones that our industry faces, and ones that our populations face. And where is that going in the future? Okay, one of those, just to give you an example, a lot of what we're talking to our vendors about right now is our at-risk strategy. We are going full force into population health. We are about changing from becoming a healthcare service to a system that impacts health. And that's looking at the individual as a whole. How do we take care of them and actually keep them out of our facilities? And if you think about that, how do I take care of my entire population that I'm responsible for and be successful at risk? Then that can only be done with really, with driving efficiencies forward and scaling resources. How do I take my limited resources and spread them across? How do I make sure that the decisions I'm making, right, decisions that I've never really had to make before, tie together to make sure that I'm making the right, going the right direction with my population? And how do I pull together data and make some use of it, make some intelligent analysis and business insight when I'm drawing in now data from all over the place, right? It's not about a single event or about a medical record anymore. It's about knowing that population, that individual, and a personalized journey for them, and to make it meaningful. So we obviously have a lot to work to do just in that corner, right? But there's going to be things even that our vendors, our strategic vendors, can't fit into their roadmap that we need to help support that. There's, and that's where we're looking at venture funding, working to really help identify startups that can help expand the capabilities of those platforms, can work in conjunction with them to give us what we need. And so venture funding is one of our latest, it's sort of our, I would say it's a baby step right now that we're taking right now to help identify those companies and support them not only in just a financial manner, but how do we help provide them with insight and really guide them, right, through their journey to fill these gaps, right? And the last one is cloud development. And this is new for us. We're not, healthcare, and most healthcare systems, I think, are not development shops, right? And so this as well is sort of a new thing for us. How do we, as our core partners, are opening up their platforms, which is fantastic. And it is something I'm very excited about because it shows how open now a lot of these vendors are to partnerships. As they open up their core platforms, how can we take advantage of that to find sort of the things that we know are sort of smaller gaps and help fill those holes and put them out there on their marketplaces. And so we're actually we're actually in the process right now of identifying all of those use cases, and we have quite a few of them actually, and figuring out what is the proper use case to go after, what's going to be our initial proof of concept, and then developing the team around that to go after those. So that's pretty much a summary right now of the Cloud Innovation Lab, and I'll let Dana go into a little bit more around her space because she supports all of that I've just mentioned as well, including especially around the cloud development. Her team is part of the team that we're looking at that can bring not only sort of the insight on some of the gaps that they see in the product, but actually work on the development of some of those pieces as well. And so I know that's where creating capacity is really important.
Thank you very much, Kristen. So I want to sort of share with you the journey that we've been on for about a year and a half to really create the capacity for innovation and become a better partner. Those were really our two main objectives, and the innovation, as Kristen stated earlier, that we were going to work on was really around core and adjacent. And core, the way that we embrace it within my organization is that core is about using the tools of today in order to help our stakeholders move forward, continue to capitalize on the ROI from the systems and processes that we have in place. And adjacent is really around using the tools of today or technology that we already have and leveraging it in places that is unexpected or unconventional. And so I want to further explore how we started on our journey to becoming a better partner. So these are the steps that we took as we looked out on who we wanted to become. And there's stages in our performance and how we were going, but we really wanted to be a strategic partner. However, we were reactive. And we weren't just reactive, we were really there. And so, and I think to some extent didn't even understand the volume and other aspects of what was going on around us as we had developed into a larger team, but really the capacity was exceeding us. And so we knew that as a team, we could be better than that. We could be proactive. And so we looked at options on how we could become proactive, and they were very, very close, right? They were achievable and deliverable. And so one of the spaces in which we were able to deliver them was simply instituting some monitoring around our softwares. And a great example of that is our integrations. In our, prior to this year and a half, we were waiting for a ticket to come in, someone to let us know that an integration had failed and to tell us what to do. But really we had ownership in the game, and we could monitor for an integration that failed. The systems enabled us to do that. And we could institute those programs and monitor for it, and we could be proactive in the services that we provided by reaching out to our customers and stakeholders and letting them know an integration had failed, what the next steps were, and how we were going to partner with them to get it fixed quickly. And when we were able to do that, we were able to create some capacity for continuous improvement. And continuous improvement or optimizations really was how do we move our organization forward incrementally to make sure that they're achieving their ROI. And a space in which, we were recently able to do this was our payroll department receives 400 transactions every pay cycle asking for manual intervention in our processes. And we were able to put together an optimization to fix 90% of those transactions and track against it to make sure that we're continuing on an evolutionary journey with them. And as we start to get at the pieces that are keeping them up at night, we're really able to elevate into strategic partner. And really where we saw ourselves being effective in that area was around magnet certification. And in order to maintain our magnet certification, our nursing department had certain metrics that we needed to achieve, as well as programs that they wanted to institute, but they didn't have the technology or sort of the processes to go along with those implementations. And we were able to partner with them, create programs and metrics and reporting that allowed them to self-service on metrics, as well as design and implement a program that allowed them to use the tools of today, right, the benefits tools, not in nursing, benefits tools that we could then transform into a scholarship program where that we could do a prepaid scholarship program for BSNs and pay the schools automatically through an automated paperless process. And I think all of those steps combined enabled us to become a better partner. And, you know, sometimes we think of these as steps and you pivot to the next one, but the reality is we function in all of these steps at any given point, and it's really about where we choose to spend the majority of our time. And so as we've taken these to becoming a better partner, it was about next creating that capacity for innovation. And I'd like to walk you through the steps or journey that we took to get there. And so the first piece was really understanding our delivery model. And our delivery model, at the time, we were really just flying by the seat of our pants. We were, you know, having a phone call in and something was wrong and we had to fix it. And we didn't really understand how much work was actually on our plates. And for lack of better words, we were sort of drinking from the fire hose. And so the first thing that we did was institute a ticketing system. Sounds simple, but it was so impactful. In the first month, our tickets were 168. We were overwhelmed, and we needed to figure out what we were going to do about it. And so, and I want to sort of go back to the tickets. This was a mix of break fixes, optimizations, and expansion work, so major projects. And we needed to trend that information so that we could best understand how our business worked. And we also needed to evaluate in the delivery model what our metrics were going to be to talk about success and how we viewed ourselves and how we wanted our customers to view us as well. And we realized that delivering on time based on our commitments was a huge satisfier to our customers, and it was what they were asking for. And so we needed to find out why we weren't. And we instituted a scoping program because what we found out is that we weren't delivering on time, but we really didn't know how long it took us to do our work. And so in order to institute a scoping program, we really had to identify the services that we provided. And we identified that we provide 25 services. And when we scoped to those services, we didn't miss the things that we were missing when we scoped in our minds. And so that enabled us to really get to, you know, how many hours did we think it was going to take us versus how many hours did it actually take us. And we were really able to implement an effective program that allowed us to target and deliver on time. But delivering on time wasn't enough. It had to be quality work. And so we looked at metrics that would sort of enable us to find out if we were delivering quality work or not. And we found a metric called defect containment that enables us to really find out how many defects occur within the testing period and how many occur within 30 days post-go live to determine basically the quality and how many things did we get right during our testing and our design and our delivery. And so those metrics all together, compiled with really understanding what was going on, enabled us to effectively change our delivery model. And that spawned what we call managed services. Managed services is where we monitor, maintain, transact, and we fix the stuff that's broken. And that was an area that had a different need. What we realized was there's not just managed services, but there's other work that we were doing around optimizations or i.e. projects. Managed services was different. It needed us to be reactive. It was our reactive work. And so we needed to create the capacity for individuals to be ready and able to work on those items effectively when they were happening. And so before that, we had projects and managed services all mixed in, and so the same resource could be tapped on to talk about something that was operationally going on, as well as being held accountable to delivery dates for a project that might not be delivering until 6 months from now. And so managed services really allowed us to create that divide in our two populations and really start to manage the work that was going on the day-to-day. And projects encompassed two aspects. Projects were really, what we identified was we needed to optimize our current platform to continue to get the ROI, as well as we were doing expansion work. We were expanding our services out into new stakeholders, new platforms, and we really needed to deliver them differently and on time. And so all of the metrics that we found out in sort of the stage one of delivery model really came into play when looking at how we were going to effectively manage our projects. The first thing that we realized was this needed to be an agile format. And if we were going to deliver successes, we needed to deliver them incrementally over the long haul, as well as we really needed to understand what was keeping our stakeholders up at night. We had a laundry list of requests that they wanted to go in, but we realized if we could just understand what their biggest problem was, and if we could make incremental successes on that problem, a lot of the things that we had on our list would naturally start to go away. And so we instituted 4 and 8-week sprints inside our optimization. We also hired a release manager, which validates the new work or the new functionality that's readily available. And we instituted some structure around the way in which we were going to do optimizations and how we were going to function within our stakeholders. And then projects, we sort of continued on the same journey that we were on with the traditional PMO support as well as delivery dates. But one of the critical pieces that we instituted in our optimization was around release schedules. And so when we started to look at how we were using resources and how we could use them more effectively, we recognized that having a standard approach to when we were going to release new functionality to our stakeholders, as well as structure our resources to go on and off of projects, having that a standardized approach was really going to be what set us apart. And so we instituted that we no longer were going to do break fixes unless they were an emergency for a release, except for on Fridays. So on Fridays, we'll release all break fixes, but during the week, we're not doing it on demand, and we really needed to make sure that we use those resources to the maximum that we could to deliver the product, as well as set expectations. And we also looked at, we were going to do it monthly for all of our optimizations. Since we were already on a 4 and 8-week sprint, it made sense to end it on the end of a month, and that would allow us to really stagger in our resources as well as using stakeholders. We realized that we were asking them to test, and we were bringing them in at multiple interviews, potentially the same resources, days apart for different projects because of the lack of coordination. And so we were able to bundle all of this together and create a shared responsibility as well as shared expectations with the individuals. All of these things combined really allowed us to create enough space between the work so that our resources could really become catalysts for innovation. And they could really start to think and internalize the problem, as well as how we could think outside of the box in unconventional ways to really deliver a product that exceeded the user's experience. I'm really proud of all of the work that we've done over the last year and a half, and we have much more work to continue to do as we go forward, but I'm really excited and look forward to the future. And with that, I'm going to turn it over to Kristen Raber.
Thanks. So, as I mentioned before, why are we doing this? Right? Our healthcare landscape is changing. We're changing. We're transforming as an organization to bring in at-risk strategies, take care of our populations and an entire individual, right? And we have to figure out how do we merge that new world with the world that we have today, because our pay-for-service isn't going away either. We have to be able to figure out how to move both of those worlds together and drive down those costs and find those efficiencies, right? And culture is a big piece, it's a huge piece of it, right? Because we're requiring everyone in our organization to think differently than they do today, to think about how we take care of people differently, how we get paid for what we do differently, and focusing more on how do we keep people out of the hospital, right? Instead of taking care of them or just focusing on sort of at the moment of an event and afterwards. And so making that connection with the rest of your organization, making them realize that it's not just, we have pockets of innovation that I'll talk about, right? It's not just about my Cloud Innovation Lab. It's not just about pockets within the operational space. But it is a requirement that we need everyone in the organization to have this responsibility of innovation and looking at how they do their business today differently. And so creating that core competency, right? Innovation is a core competency of your innovation is not easy. We're at the beginning of our journey, and we've been underway now for a year or two of really changing the way we think, right? And so that strategy, right? In order to be successful at it, we have to bring in these new technologies, but we have to bring people along for the ride at the same time. And that cultural shift, at least in our case, you know, it's becoming successful because it's really coming down from the top. It is top-down support. You know, we're working to create these safe spaces for exploration and for risk, allowing people to feel empowered in changing the way that they work and questioning the why, right? It's about removing assumptions. At the beginning of my agenda, I had a quote in there about, the things you can find if you don't stay behind. And that's from a Dr. Seuss book called Go Beyond Zebra. And in that book, it's really cute. In that book, you know, the author, the narrator, is telling the person on there that you need to think beyond A to Z, right? That there's a whole alphabet beyond A to Z. If you just remove your assumptions, that's where the alphabet ends. And that's what we're trying to teach people here as well. Stop with the assumptions that you have. Start questioning and removing them. Start thinking of the impossible as possible. And we'll support you in that, right? And you have to make them believe that support is going to happen, and not only make them believe it, but you have to actually show it. And that's what we're working on now. We have strategies in place where we call something called humble inquiry, where instead of just solving a problem when somebody comes to you, you actually just help them with figuring out how to come up to the solutions themselves. We continuously ask why about things, right? And you know, if it is something that is a small thing that they can take care of themselves or within their span of control, empowering and allowing them a safe place to do that. And then where it is something that's sort of outside of the span control, making sure that there's tools and ways for them to bring that forward to those that can help that make that a reality. So we have mechanisms, inputs we've put in, innovation challenges. We're putting in a lot more around pulse surveys and supporting people actually shadowing and going into different businesses to learn how that business is working and how to take care of people. And we are driving more people into communities and learning what's going on with the individuals, with our patients, so that we can really drive better value in the care that we're providing. It is really about making that human connection for people and giving them personal motivation for this innovation to make our organization a better place and to make our community a better place. So I'll just end with a few takeaways, and the room's not going to last forever, right? This is not the time to be isolated. It's not the time to be complacent, right? You need to take bold measures, set an island on fire, and just get off that island, right? And part of that is going out and seeking new friends and make it diverse, right? You need to think healthcare today, there are unconventional people getting into it all over the place, right? How do you help drive that forward by, looking at partners that maybe you wouldn't have before, not only internally, right, but outside of your industry as well, being the connection point to drive that together. Innovation today shouldn't just be sort of the old school research and development locked down into a basement behind, layers of security anymore. If we're really going to make a difference, we have to do it together, because this is a noble cause. So find those friends, collect them, right, and go on those grand adventures with them. And make them and everyone else in your organization realize that you can go beyond zebra, right? It's about thinking differently. And so hopefully this will encourage you as well to address and go after those big problems, right, and explore and, maybe even have a little fun along the way. There are some great things that can be done in healthcare today. So I'll turn that over to Sarah.
Thanks so much, Kristen and Dana, for sharing your story and how you are making this happen at Christiana Care. So we do have time for some questions. For those of you listening, if you have any questions for Kristen or Dana, you can go ahead and type them into the Q&A box on your screen, and we will go through and get to as many as we can. And let's see. To start out, a question for you, Kristen. You mentioned that you're leveraging partners to accelerate innovation. Can you share a little bit about how you evaluate different partners before deciding who and when to approach them?
Sure. So, our main criteria really is looking for those that have the same spirit of innovation and ones that really share our goals and our mission statement, are looking for really large leaps forward and are really willing to listen. We don't want the standard vendor relationship where there's sort of a roadmap already in place and a product that's coming to us and they're looking more for our reaction to the product. We want those that are actually going to listen to our problems first and work with us in a new way to help solve them, right? We're willing to dedicate resources with the right partner to really accelerate and move these forward. But it is, not only sort of a new way of thinking for us, but it's sort of a new relationship with our vendors that some of them are not quite expecting as well. So I think it becomes pretty obvious pretty quickly those that sort of have the capacity to think differently and really want to listen. I think, the space right now that I want to be in as well is those vendors maybe that are not so confident in the healthcare space, right? Going after, at least initially, the more unconventional partnerships, the ones that maybe go across multiple industries and are looking for specific help within the healthcare vertical.
That makes a lot of sense. Thank you. So question for Dana. You talked about your journey to create capacity for innovation in shared services. Do you have any advice for folks about potential obstacles at different points in the process and maybe how to get past them?
The biggest that I came across was sort of the day-to-day really impedes your ability to sort of focus on future plans. And or a leader has to really take the time to say, I'm not going to focus on the fire that's raging today. I'm really going to plan for tomorrow and make sure that my team has the proper infrastructure around them to be successful. And the other aspect that I'd like to sort of share is listen to your stakeholders. They can see it from a different lens, and sometimes that takes a lot of self-realization and really a moment to absorb, but it will really make the difference between how you change in the future and whether or not it's received well.
I think that makes a lot of sense. So another question for you, Dana. How do the systems you have in place today sort of factor into how you were able to adopt and drive this innovation model?
So that's a great question. I think there's some of it that Kristen had shared before, which is around having partners that are innovative and listen. But I think there's two pieces. It's really around having the right resources that can drive new processes and to Kristen's point, the courage to really step outside of the status quo. And then the next piece is really making sure that the partners that you have from a systems and tools are really capitalizing on the tools that are available or are open to hearing what tools they need to make available so that you can drive your business forward and really make a difference or an impact.
That makes a lot of sense. So a couple of questions that are sort of related. One is about the general structure of your team and how you balance the needs of internal optimization versus innovation. And the other one is, were there any changes required to your org chart and the reporting structures to get to the innovation pathway you're on? So sort of a before and after there in terms of how you guys are making this work. I'm not sure if that is best for Dana to answer or for Kristen to answer about the organization structure.
Hi there. I think we lost you for a second. So I'm going to talk about the structure and the changes that we made, at least in the Cloud Innovation Lab. The changes we made are mostly additive to it, and where we utilize resources to help move us forward from the different business areas. They're selected, personally hand-selected, and we find the capacity, and this is where you really need the top-down support, right? They're hand-selected, and they tend to be some of the best resources that you have, right? And so they're in high demand. So we have to be very careful to make sure that we are utilizing those resources in the best way possible. Now, something that we plan to put in place is, actually internships. So how do we pull some of those resources out and actually out of their regular job, right? And this is where some leaders start getting really uncomfortable. How do we actually pull them out of their day-to-day business and allow them to really focus on one of our partner initiatives for 6 weeks or a couple months at a time, right? And like I mentioned, these are key resources. And what I have leadership support on this, but I think once we really start executing it, it's going to make people a little nervous. And what I can say is it's going to be worth it for them, right? It is not only is it going to help those leaders think differently, learn more about emerging technologies, and learn how to implement things faster, know what's possible, but it's also helping and forcing you to develop those leaders underneath them to take over when they move on to something else. And then, Dana, if you want to talk about any structural changes that you've made.
So I think I talked a little bit around the structure changes that were implemented around division of teams and really reallocating resources to focus on certain types of work. The team is relatively small. We have about 13 individuals, and really making sure that they're doing what their strengths are is critical to having a smaller team to support two platforms.
Thank you for clarifying that, Dana, and also for your comments, Kristen. Let's see. So there's also a question just sort of on the details of how Christiana Care is organized. How does the Cloud Innovation Lab partner with or complement or differ from some of the other organizations at Christiana Care, like the Technology Innovation Center or the Office of Transformation?
Sure. So we, I think I mentioned there's a few pockets that are focused on our innovation, right? Our Healthcare Technology Center has been up for a few years now. They're helping support that culture of innovation, teaching some innovation classes, but their main focus is really twofold. One, looking at technology as it comes out. So, for example, augmented reality glasses, right? Is that technology ready for use? Is there space for that within the healthcare system? And the second part is looking where there's actually gaps across an entire marketplace, right? So where I have a team that's going to be focusing on the developing on an individual partners platform, and for smaller gaps, they're looking to see, is there anything in there that really is a startup space, and creating a solution for those. We have another team that's called actually our Applied Innovations group, and that team is supporting our at-risk strategy as well. So they are working with vendors and creating new relationships with some of those vendors around at-risk strategies. So if you can think of it in the sense of, we're typically, we buy something, right, like a piece of hardware or medical device, and we just pay whatever that price is, regardless of the outcomes. And our relationships are changing. We have vendors now that are open to actually going at risk with us, right? So, how, is that device, instead of paying for it up front, they're in with it. Is it showing the outcomes for that patient? And if it is, then great, they get paid and we get paid. If it isn't, then they don't, right? And it is a new strategy for them as well. And luckily, we've been able to find some innovative partners that are willing to do that with us and really support that population, the way we're going with population strategy. And then the last part is our Office of Transformation. And they've really looked sort of across at what is going on within our system itself. Where can we drive efficiencies and transform the business, our business that we do today? And so all of these pieces are sort of, creating this web of innovation. And what we're doing now is pulling them all together into a single strategy and utilizing the best of those resources to figure out how do we, again, not only drive innovation sort of across the board in all these different pockets, but then also support creating that core competency of innovation in our organization.
That's great. Thank you. So we have just a couple more questions. One is about the venture funding you mentioned. Are you partnering with VCs or making your own investments in startups, building a separate investing capability, or?
So we actually have a few different strategies that we have in place. We have one strategy where we're investing with a VC. We're a limited partner, and that is looking at digital healthcare platforms. We have another personal fund that is just a Christiana Care Fund where we are supporting startups that we have a relationship with, right? So really building them up and helping them be successful by being not only providing the investment, but also supporting them by doing proof of concepts and allowing them to work within our space and with our providers. And then we have the third piece, which is that new piece, which is the Cloud Ventures portfolio that we're going after. And that one is really about working or identifying startups that can be extensions to our core cloud platform.
Great, that makes sense. And then the last question here is, you guys talked so much about how you've really infused this attitude into the overall culture, really spreading a culture of innovation. How do you see the work that you're doing transferring into the clinical care space?
Well, our clinical, is the core of our being, right? And so, we need those outcomes, the clinical outcomes, to be better. We need the efficiencies, and we need to learn how to transfer our care from just being in the hospital to being available to people at home and where they are, right? It's about how do we make sure that we are delivering health care and wellness to people and meeting them where they are with the right tools in a way that's meaningful and valuable to them and with the right people involved, right? And so it's not something that's just, it's not just a financial piece, right? It is, it's about driving value and wellness for our populations. And so, from a clinical standpoint, some of those, especially our Applied Innovations group, not only those new relationships around devices and that sort of thing, but they're also driving forward those innovations in the clinical space as well. So we look at innovation throughout the entire organization.
That's great. So I think we are at the end of our hour. I want to thank you both, Kristen and Dana, so much for sharing your story and for being generous with your time answering the questions from the audience. I want to thank everyone for joining us. And with that, I'm going to hand it back to Brian for just a few closing notes.
Yeah, thank you so much. And that does conclude today's webinar. On behalf of Becker's, I just want to thank Kristen, Dana, Sarah, and Workday for the insightful presentation, and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.